nobody can sleep. Sorry. So, can you put on my slides? Yeah. So, yeah. Okay. So, the title is given to me, and I have been asked to shorten it as much as I can. Development of chronic lung diseases from life-spanning mechanism to preventive therapy. And we have heard about heart. And we know that we breathe 500 ml of air with every breath, 15 to 20 times, and about 10,000 liters of oxygen, air that we are breathing, that goes inside. And that is how emphasizing the importance. As far as the pulmonary physicians is concerned, it was considered as, before 1970, a chest and TB doctor. And after that, it went on to say that, okay, in 2000 it became a pulmonologist, and then became high-tech bronchoscopies, ICUs and ventilators. And then came COVID. And we realized that, COVID affected lung, of course, every organ of the body. We were called warriors. So many doctors, so many physicians, so many nurses, so many healthcare workers died providing service, and it has also left with several of millions of people with long COVID, with lung fibrosis, patients having cough, patients having heart attacks. But that's not the subject that I am dealing. Sorry. I'm so sorry. I don't know what's. So, what are the challenges in the lung disease? As I said, before 1950s, tuberculosis was treated in sanatorium. Then became asthma, COPD, and all those things became important. And now, the pulmonary physician is dealing with sleep apnea. Everybody is talking about sleep, whether he is obstetrician, whether it's a cardiologist. And sleep disorders, breathing, and sleep apnea is a huge, huge subject. Critical care has become important, and I'll be talking mainly about COPD, asthma, and tuberculosis. So, COPD, asthma, tuberculosis, lung cancer, and post-TB COVID lung become an important part which requires lifestyle modification. So, what is preventable? And what is man-made? And what is genetic? As the title is preventable life-spanning mechanism, tobacco smoking was considered which causes 90% of lung diseases. But ladies and gentlemen, it has changed. The data has shown that air pollution is causing 50% of the lung diseases. Tobacco smoking, 25%. Others are mainly occupational, mining industries, power plants, variety of industries, asbestos, so on and so forth. Irony is that all are preventable. And I'll be talking about the extent of problem. And if you talk about the magnitude of the problem, India has 18% of the world population, but 32% of Delhi's, that is disability adjusted life years. What does that mean? Number of premature deaths and number of years lost because of the disease. The sum of that is called Delhi, and that term I will be using in my presentation. And 32% of Delhi's, that is the death and the disability, is caused by non-communicable diseases in India as compared to the 18% of the population. 8.7% of the total deaths in India occur due to COPD. However, the asthma incidence has not gone up because basically it's a genetic origin. So what is the cause? I don't have to emphasize the air pollution. We know the traffic in Delhi. You are seeing the picture in front of you, the industries, the burning of parali. Indoor air pollution, household air pollution is a big menace. And in a lady that you are seeing cooking in this field, the PM10 rises to 30,000. 30,000. And India doesn't live in only urban areas. 60 to 70% of the Indian households are still using household. And of course, the active and passive smoking is extremely important. I don't need to emphasize that. With that, the Delhi becomes world the most polluted city. And there is the crux of respiratory medicine lies, and I have to finish faster as I've been told. And with the result that this is the India gate that we see before Diwali, and this is the India gate that we see after the Diwali. And we saw one special India gate that was during lockdown. We saw this blue sky, what we see in the Western countries. When I land up in California or New York, sometimes I feel my vision has improved because I am seeing far distance, I am seeing a blue sky. That is exactly what we saw during lockdown. And this picture is of that time. That means there is a potential to have this kind of environment. There is a potential to have this kind of air quality that we breathe. And I'll talk about what is the impact of this. The impact is on your left you see a healthy lung which is on taken surgery from a patient who is from Himachal Pradesh. On the right is the Delhi lung. This is a post-op case provided by Dr. Arvind Kumar, and no amount of inhalers, no amount of antibiotics can change this right side lung to the left side lung. So what does air pollution does to us? And this is a paper which we published in one of the international journals. What it does is that it increases premature deaths, and these are all Indian data, not international data. It increases the respiratory cause and mortality. It increases acute exacerbation of obstructive air disease and asthma. It increases health expenditure. And why the respiratory medicine has become important? This is a study which was published on 3,400 clinics and more than 2 lakh patients in this country. This was a single day study. It was found that 50% patients approaching GPs had respiratory symptoms. And this is all man-made. And I'll now come to tuberculosis. And this picture that you are seeing on your left is of Egyptian mummies, 2400 BC. And if you go into the history, the TB was known from millions of years before. But India is also a capital of tuberculosis, which is a communicable disease. And of course, we are trying to control it, but unfortunately, 21% of the world tuberculosis lies in India. The MDR TB, multi-drug resistant tuberculosis, is also extremely common in our country, and this is also a man-made. Why you don't see tuberculosis in United States or in the developed world? Because they have been able to control it. It's not that they didn't have it before. So there are advances which I have been asked to talk about. That there are guidelines, and India has actually pledged, the Prime Minister has pledged that we will have TB Mukt Bharat by 2025, although WHO said 2020. This is because there are good diagnostic techniques we have, there are good treatment that we have, and there are good preventive strategies that we have. The NTB project, as I said, that India pledged to do it by 2025, but what happened during COVID times? Air quality improved, but TB management took a back seat. The direct observed therapy, the diagnostic, patients were not going to the clinics. So the tuberculosis incidence after 2021, instead of coming down, has gone up. And of course, we hope that by 2025, we'll reach somewhere. Now, coming to the last part of my presentation, that what are the developments in the diagnosis and control of chronic respiratory diseases all over these years. Now, if you see on your left lower part, the stethoscope was like a tube. Now we had a stethoscope. Laennec gave us. Pulmonary functions have improved. The polio epidemic ventilators were there. Now we have advanced ventilator. Instead of X-ray, we have a CT scan. The tremendous developments in, but pulmonary function test, you blow into a machine and you know about the condition of the patient. The artificial intelligence is further adding to that. Now, tuberculosis have seen tremendous development. Previously, only smear was examined. Culture used to take 6 weeks. Presently, we have this technique of what you call as gene expert. I am sure you know all about it. In 2 hours' time, we know whether the person has tuberculosis. Not only that, we also know whether this person has MDR tuberculosis. So therefore, tremendous. The 18 months treatment has been reduced to 6 months, and now the research is going on that treatment should be within in a period of 4 months, but still that is not. There has been a further development of line probe assay, as we call it, Heinz test, which gives a resistant pattern in a short period of 1 to 2 days. And all these things have led to the better diagnosis and better treatment of tuberculosis. And even the latest development has seen that even MDR treatment can be done in a period of 6 months. Finally, what is the role of artificial intelligence in pulmonary medicine? Now, there are ways of analyzing data, there are ways of collating data, but there are few things which have occurred. One is reading of the X-ray. There has been methods of reading of the X-ray that the artificial intelligence will tell you that this patient is likely to have tuberculosis, this patient is likely to have pneumonia. There is a way of collating lung function test with the uh, X-rays. Now, this is the repeat slide has not come by chance, because I want to conclude by saying that chronic respiratory disease are 50% because of the air pollution. I want to emphasize that 25% because of tobacco smoking. What is the goal? The goal is sustainable development goal. The target is to reduce premature mortality due to non-communicable diseases by 1/3 by the year 2030. But the India government has said no, we'll reduce by 25% by year 2025. How can we do that? The goal is the early detection of lung disease, control of tobacco smoking, decrease use of household solid fuel, and control of ambient air pollution. Over a period of time, household air pollution has diminished. This is because of the development, socio-economical development. Prime Minister's Ujjwala Yojana, where as many as 10 crore cylinders were used. This is not politics. But ambient air quality has gone bad. I was listening to our Honorable Minister for Transport, and he said by 2030 50% vehicles will be electrical vehicles. And that is the way forward. So therefore, artificial intelligence use, as I said, can read the X-ray. You don't require a radiologist. They will tell us whether this is likely to be tuberculosis. It is used in pulmonary function testing also. But what I have written in the lower end, the long way to go before its utility is determined in pulmonary medicine. I am not regressive. But presently, as far as the pulmonary medicine is concerned, we are much, much away from using artificial intelligence in giving us patient management. So I have to conclude, and I want to give certain messages. India suffers from disproportionately large number of chronic respiratory diseases, including tuberculosis. There has been advances in a diagnostic procedure and therapeutic options. We saw in COVID, ventilators, oxygen. There was a time 20 years back, nebulization machines was rarity. And today when I ask my patient, do you have a nebulization machine? Yes, yes, we have. Majority of people are having oxygen concentrators at home. Control of outdoor and indoor air pollution is key to reducing respiratory morbidity and mortality. Tobacco consumption is a big menace for all systems of the body, and its control would lead to reduction in respiratory diseases also. A great program of TB control is on, and we hope to attain TB Mukt Bharat soon. But how soon, I cannot tell you. Finally, the control of air pollution and tobacco use require a mass movement, which requires contribution not only from policymakers and administrators, but from each individuals of the society. Last slide, our father of the nation, Mahatma Gandhi said, the difference between what we do and what we are capable of doing would suffice to solve most of world's problems. Thank you very much.
Thank you so much, Doctor. So next up, and probably the last session before we break for lunch, is on non-communicable diseases, which are posing a significant public health challenge, especially in adults. Nutrition and NCD in children